This is Dr. Khushboogadda, and this week we are going to learn what are the signs of injury and what steps you can take whenever you sustain an injury. First and foremost, do not forget to subscribe to my channel and hit the bell icon so that you can get a notification whenever I upload a new video. So, whenever you sustain an injury, a fall, or your body sustains a trauma, what are the signs which come into the picture which your body shows? These signs are pain, redness, warmth, swelling, and loss of function. The first sign, pain. This is the most obvious sign of an injury, and the intensity of your pain would be at least 7 out of 10. To understand what pain is and the mechanism of pain, I have attached the link down below in the description box to my previous video. Then comes redness. Whenever there is an injury, the blood vessels around that part immediately start to dilate or they become widened, and there is more blood supply which happens in that part, because of which there is redness in that part. Warmth. Because of the increase in the blood supply to that region, there will be slight warmth when you touch that part. Then comes swelling. After an injury, there will be more accumulation of fluid and blood in that region, which makes that part swell up, which indicates an injury. Finally, there is loss of function. This means that the part which is injured will not be able to move and perform its normal function. If there is an injury in the leg, then you might not be able to even put weight on that leg. Now, what are the steps which can be taken within the first 24 to 72 hours of an injury? The steps are abbreviated as PRICE. P stands for protection, R stands for rest, I stands for icing, C stands for compression, and E stands for elevation. Protection. First and foremost step is to protect the injured part from further damage and to support it. This can be done by using a sling or a bandage. Rest. Immediately after an injury, it is very important to rest that part so that there can be better recovery. Now, the duration of the rest period varies according to what kind of an injury you are having, but it is very important that you do not use your leg or your hand immediately after an injury and give rest to that part. Icing. Many a times I hear that after an injury, people have dipped their leg in hot water or applied balm to that area. Please do not do that. After an injury, because of the increased blood supply to that area, swelling, heat and warmth in that area, you should apply ice to that part. So it is important that you ice the part because icing helps in reducing pain and reducing the warmth in that region. Icing should be done every 2 to 3 hours for at least 15 minutes. Compression. After the icing is done, compression is a very important step. This is done by using a compressive bandage or a brace or belt. Compressing an injured part helps in reducing the movement in that region and helps in recovery of the tissues. This should be done only during the daytime. It also helps in reducing swelling in that region. The last and final step is elevation. After you are done with icing and bandaging the part, rest that part comfortably on a few pillows. This elevation should be done above your heart level. It is very important because it will help in reducing the swelling which has accumulated in that injured part. Finally, I would like to stress that whenever you sustain an injury, please seek medical treatment from your orthopedic doctor or a physiotherapist for the same. Many a times, if the above steps are not properly followed, there are chances of re-injury or the tissue not healing properly. So it is very important that you follow the above steps and seek medical treatment for the same. So that's it for today. If you like my video, do not forget to like, share with your friends and family, and subscribe to my channel and hit the bell icon. You can follow me on Instagram, Twitter, and like my page on Facebook. Thank you.